My Lords, as the last backbench speaker in such a rich and informed debate, the fact that in the Green Group that each week we start at a meeting where we asked ourselves what original things do we have to say specifically as Greens about this bill or about this debate, it's really useful to have at this particular point in the circle, because I first of all want to say that as Greens we very much agree with, I think as virtually every noble lord has said, with the need for this bill, and we also very much agree with the need to strengthen this bill. I would, however, respectfully disagree with a number of noble lords who have suggested that we're seeing an over-medicalisation of life events, that we don't have, perhaps this wasn't quite what they meant to suggest, but it kind of came out sounding like it, that we don't have a mental health crisis in our society, because I would very much say that we do have a mental health crisis. I'd agree with the noble Lord, Lord Crisp, that there's a great need for more talking therapies, and that for want of those, medical professionals are very often forced to resort to pharma solutions, and we need those talking therapies, but we need treatments because we have a mental health crisis. And behind that is not any characteristic of individuals, but a deeply unhealthy society. And when we're thinking about this bill, we have to think about this bill in that context. And we have to think about the fact that when we compare ourselves to societies that we generally consider comparable, we have much greater health problems than other comparable societies have. And we have to ask ourselves the question why that is. And this is true of mental health and it's true of physical health, insofar as it makes any sense to make a division between those two. I don't think anyone has yet used this evening the phrase the gut-brain axis, but in the last decade there has been an explosion of understanding of the link between the microbiome and mental health. And we have, particularly in the UK, a broken food system. Now, this is, of course, a long way from the legislation in this bill, but it's the context, if we're going to think systemically, it's the context in which we have to think about this bill. And of course there's also the social issues. Some noble lords have made some reference to this. The levels of poverty, the levels of insecurity of income, insecurity of housing, jobs that actually make workers ill from the pressure, the way in which they are treated as though they were robots, that make people ill. We have a loneliness epidemic, and I don't think anyone has mentioned that yet this evening, but that is very much related to our mental health epidemic. We have a huge problem with domestic violence, which is also related to mental ill health, particularly among the victims who suffer as a result. We need to take a public health approach to mental health, and whilst that's not directly part of this bill, we really cannot talk about mental health without talking about all of those issues. In terms of another couple of areas in which the Greens take a unique approach to the mental health issues, we do not believe that the coercive power of the state, which is what this bill is talking about, should ever be put into private hands, and we do not believe that healthcare should ever be run on a for-profit basis. And I'll pick out here the points made by the noble lady Baroness Keeley about some areas in which private provision of mental health care has gone horribly wrong. And thirdly, I would point out a number of noble lords have focused on the problem of stigma and the way in which perhaps we have made progress over recent decades, but we still have a great deal of progress to go. And I would very much say that we have to think very carefully, some very senior people in our society have to think very carefully about using rhetoric of strivers versus skivers, and a suggestion that all we have to do is get these people into a job and then they'll be fine. Because that is the underlying message we are hearing from certain very senior quarters. And I think I have to make a mention of the fact that there's been talk of combining support for people seeking jobs and mental health care. I wouldn't necessarily say don't do that, but I would say that has to be done with extreme caution to ensure that this is not something that puts more pressure and stress on people and interferes with them becoming well. Now, I do want to perhaps more positively both commend the government for bringing this bill forward very early in its term, and also to commend the government for making this a bill that starts in the House of Lords, because I think the comparison that I would make is with the domestic abuse bill, which quite a number of noble lords who've taken part in this debate also took part in. And I think there was a genuine cooperative effort from all sides of the House to make that bill better. And I think it's been very clear this evening that there is the same desire in this chamber. And I think many noble lords have made the point about the need to actually resource what's in this bill. And that was also what we were saying in the domestic abuse bill. I'll single out a few, Lord Alderdice, Lord Aberdawawe and many others. And I think there's also been some really good ideas come up in this debate, and I'm going to particularly single out the noble lady Baroness Watkins. The idea of a safe staffing level for community services, to me, strikes me as a really, really potentially transformative idea that is really essential. Far too often care in the community has simply meant being abandoned in the community and being left in the hands of horribly overworked staff who are then subject to abuse and questioning when things go wrong because they simply have not been able to handle the workload through no fault of their own. And it's really crucial that we tackle those issues. So I'm going to very quickly whiz through some specific points of the bill, particularly focusing on things that other people have not said. And I haven't heard a great deal of discussion of the idea, as recommended by the Joint Committee on the Draft Mental Health Bill, that we have a mental health commissioner. And the briefing from the Centre on Mental Health draws a parallel with the powerful impact of the Children's Commissioners. I would also add the impact of the Patient Safety Commissioner, with which I worked with the noble lady Baroness Cumberledge over many years, and again was a case where your Lordship's House was very powerful in pushing to create that position. And that having that Patient Safety Commissioner has made a real difference. And I think having a new statutory role to champion mental health across government and speak up for people with mental health illness was something we really should be including in this bill. Very briefly, I'm going to agree with the noble lady Baroness Fox on the community treatment orders. This bill still allows these to be continue indefinitely rather than placing a time limit on it, with an option for a new one if needed. These should not be renewed without proof of necessity and proportionality. And I particularly want to take my remaining time to focus on the importance of children and young people, and many other noble lords have addressed and given us statistics on how our mental health services are really failing young people. And I want to draw another parallel with another element of what the government's doing, and which I have praised, which is a couple of nights ago, rather late in your Lordship's House, about this sort of time actually, we were discussing the government's plan for a new youth strategy, and their plan to make sure that there's really strong consultation with young people about that youth strategy. Well, I would ask, the one direct question I'll put to the noble lady the Minister is, I'm sure the noble lady is aware of the phrase, nothing about us without us. What is being done to ensure that there is a real say for young people, particularly young people with experience of the mental health system, to ensure that they actually have the chance to be involved in this bill? And one final technical point to rush into, the bill introduced the new statutory care and treatment plans for all patients. That's welcome, but many under 18s are admitted under an informal basis, so won't be covered by this. So how is that going to be dealt with? And finally, one final rush-in point. Lord Alderdice and others have talked about how we can learn from other parts of the UK. The Mental Health Act in Wales has a measure to give people the right to have a mental health assessment if they request help. That is surely something that we could learn from and include in this bill.